Good morning, student. So, today we will learn about the surgery in that ophthalmology. And in the ophthalmology, we will discuss about the diseases of the uveal tract. In the yesterday's lecture, we was learn about the diseases of the lacrimal apparatus. In that, we was studied about the many diseases of the lacrimal apparatus. Firstly, we will see that is the anatomical structure of lacrimal apparatus, the structure of tear film, then the dry eye, then the watering of the eye, and dacryocystitis with its types in detail. After that, we was learn about the dacryoadenitis, that is the swelling of the lacrimal gland and its types in detail with the clinical picture. And then the tumor of the lacrimal gland we was learned. After that, in the yesterday's lecture, we was learned in detail about the homeopathic therapeutics for the diseases of the lacrimal apparatus. So we was completed the topic that is lacrimal diseases of the lacrimal apparatus and its homeopathic therapeutics in the yesterday's lecture. So the today's lecture we was continue with the diseases of the uveal tract. So, when we learn about the ophthalmology, it is the also important topic that is the uveal tract and its diseases. Firstly, we will learn about the anatomy of the uveal tract. So, uveal tissue constitutes the middle vascular coat of the eyeball from anterior to the posterior, and it can be divided into three parts, namely the iris, ciliary body, and the choroid. So, however, the entire uveal tract is developmentally, structurally, and functionally one individual structure. So, when we see the diagram of the eyeball, in that we can see the uveal tract, that is the iris. This one is the iris. Then this is the ciliary body, and this yellow line is the choroid. So this is the anatomy of the uveal tract. The eyeball, along with the uveal tract, contain a conjunctiva. This is the ora serrata. This is ciliary body. Just before that is aqueous, and ciliary body is continue below as in iris. Just above the iris or just in front of the iris, there is an anterior chamber. This one is a cornea, and this is pupil, and this whitish oval shape is a lens. Just below the iris, there is a posterior chamber. So iris divided anterior chamber and the posterior chamber. Then this is the canal of Shenhua. This is conjunctiva. And when we study posteriorly the eyeball, then it shows as vitreous, sclera, choroid, retina, macula, then the arteries and veins, that is the central retinal artery with the optic nerve. This yellow is optic nerve. This red is the central retinal artery. And along with the artery, there is a central retinal vein. And this is the support of eyeball, that is the rectus medialis. So when we learn about the diagram of the eyeball, we can see the uveal tract, that is this is iris, ciliary body, and this is continues as a choroid. let's see in a yellow color. So, firstly, we was learn about the iris. So, what is the iris? Iris is the anterior most part of the uveal tract, and it is a thin circular disc corresponding to the diaphragm of a camel. It is a center in an aperture of about 4 diameter called as a pupil, and which regulates the amount of light reaching the retina. At the periphery, the iris is attached to the middle of anterior surface of ciliary body, and it divides the space of the cornea and lens into the anterior and the posterior chamber. So when we study the iris, iris is the anterior most part of the uveal tract. So when we see the diagram of the hello, हॅलो माझं लेक्चर चालू आहे ऑनलाईन ते काम होतं का नाही मी थोड्या वेळात फोन करते मला अकरा नंतर पेशंट बरं आहे ना so when we study the iris this is the iris okay iris is the anteriormost part of the uveal tract and it is a thin circular disc corresponding to the diaphragm of the camel. So it is a thin anterior part of eyeball. And its center in an aperture about the 4 called as pupil. So this one is the pupil. The iris has a center aperture in the both sides. This one is iris and this one is iris and it contains central aperture called as a pupil, which regulate the amount of the light reaching the retina. And at the periphery, the iris is attached to the middle of the anterior surface of ciliary body. So, at the periphery, iris is attached to the middle anterior surface of ciliary body. So, we can see in this diagram that iris is attached to ciliary body at this point. So, this is iris, this one is ciliary body and is attached at this point. Like in below, that this is the iris, this one is the ciliary body and they attach at this point. Okay. It divides the space between the cornea and the lens into the anterior and posterior. So, iris, we study that iris divided the anterior chamber and the posterior chamber. So this one is anterior chamber and this is a posterior chamber that behind the lens. So iris divided anterior chamber and the posterior chamber and this one is the iris. And it continues as a ciliary body. It has a central aperture called as the pupil. Okay. So when we study the microscopic appearance of the anterior surface of the iris, there is a peripheral crypt. Then there are the two zones. That is, first one is a pupillary zone and second is a ciliary zone. So when we study a pupillary zone, there is a pigment frill at the base, then collaterals, and in the ciliary zone there are the crypts. This one is the crypt, and just above that there is a contraction furrow. So this is a contraction furrow. This one is also okay, and the peripheral crypt. So they are just outside, so it is called as the peripheral crypt. So the microscopic appearance of anterior surface of iris consists two zones, that is first one pupillary and second is the ciliary. Pupillary has pigment film, collateral, and ciliary has a crypt, contraction furrow, and the peripheral crypts. So this is all about the anatomy of the iris. Then second is the ciliary body. So the ciliary body is the forward continuation of the choroid at the ora serrata. So when we study this diagram, we can learn that how the ciliary body, this is the ciliary body, it is continue as a iris, and this one is a ora serrata. Okay. So ciliary body is a forward continuation of the choroid at the ora serrata, and in cut section it is triangular in shape, and the anterior side of the triangle forms the part of the angle of anterior and the posterior chain. So anterior part of the triangle form the part of the angle of anterior and posterior chamber. So this is a anterior chamber, this one is a posterior chamber. So the ciliary body form the posterior part of the posterior chamber. So this is a posterior chamber. So it is near to the anterior part of the ciliary body. Okay, and in its middle the iris is attached. So here the point that iris is attached to the ciliary body, and this is also okay, that this is iris, this is ciliary body, this is the ora serrata. So ciliary body posteriorly connect with the ora serrata, and anteriorly it connect with the anterior chamber, iris, and the posterior chamber. The outer side of the triangle lies against the sclera, features suprachoroidal space in between. So the outer side of the triangle, that is ciliary body, consists of the triangle which lies against the sclera with the suprachoroidal space in between. And so this is the triangular part of the ciliary body, this one, which is connect to the sclera. So this is the sclera and this is connect to the suprachoroidal space in between from the outer side. The inner side of the triangle is divided into the two parts. That is, anterior part, it is about 2 mm, having a finger-like capacity process is called as a pars plica, and the posterior part, that is the smooth part, about 4 mm, and is called as a pars plana. So the triangle of the ciliary body divided into two parts, pars plicata, that is the anterior part, and the pars plana, that is posterior part, is about 4 mm, and pars plicata is about 2 mm. Next is the microscopic structure of the iris and the ciliary body. So when we study about the microscopic structure, then we can see that the how the iris is formed. So in this diagram we can see this is the cornea, this one is the sclera, and this is the ciliary muscles. This is cornea, this is sclera, this is ciliary muscle, and this one is this line is a dilator pupillae. Just end of that there is a sphincter pupillae. This one, and the pink color is that anterior limiting layer. Just below that there is a stroma, and these brown dots are the anterior epithelial layer, and this last one just below that is the posterior epithelial layer. So this all is consist, it's all is made and form the iris. And this one is a lens. So this is a, and this is the pupil, that is the aperture, and the ciliary body. So the microscopic structure of the ciliary body consists of internal limiting membrane, this one, then the non-pigmented epithelium just above that, and pigmented epithelium just above that, and the stroma. That this is a light brown color is the stroma, and supraciliary lamina. So this is a supraciliary lamina. This line just under there is a stroma, and under the stroma there is a pigmented epithelium, non-pigmented epithelium, and internal limiting membrane. So this is all about the ciliary body, that is microscopic structure of the ciliary body. And as we learn that iris shows macroscopically that firstly the dilator pupillae, this line, then the sphincter pupillae, that this is pink color, then anterior limiting layer, and the stroma with the anterior epithelial layer, and this is the posterior epithelial layer. So this is the cornea, sclera, and this one is the ciliary muscle. So this is all about the ciliary body. After that, we will learn about the choroid, as the uveal tract is made by the three parts, that is iris, ciliary body, and the choroid. So the choroid is a posterior most part of the vascular cord of the eyeball, and it extends from the optic disc to the ora serrata. So when we see the diagram of the eyeball, we can see this is a choroid. Okay, this is iris, this is ciliary body, and this one is a choroid. That is, it is placed posteriorly up to the ora serrata anterior. It extends from the optic disc to the ora serrata, and its inner surface is a smooth brown and lies in contact with the pigment epithelium of the retina. The outer surface is rough and lies in contact with the skin. So, the choroidal inner surface is smooth, brown, and lies in contact with the pigment epithelium and retina. So, this is a retina, and this one is a choroid. Okay? And the outer surface is rough and lies in contact with the sclera. So, just outer there is a sclera, and outer layer is a rough. So, this is a sclera. This blue line is a sclera, and internally there is a smooth line, that is retina, and in between that there is a choroid. So, when we study the microscopic structure of the choroid, there are the many layers that from the posteriorly we can see just posteriorly there is a sclera, just above that there is a suprachoroidal lamina, and these are the large vessels. This one is, and these are the medium vessels, and just above that there is the coracocapillaries, then the brooch membrane, and the pigment epithelium. So this one is the pigment epithelium. This is a brooch membrane, and this is a choriocapillaries. This small is medium vessel, and these are the large vessels, and this is a suprachoroidal with the sclera just after on the posterior. So this is all about the anatomical structure of the iris, ciliary body, and the color. Hope you understand all the anatomy. That before the we started the diseases of uveal tract, we have to learn this anatomy clearly so we can study the disease in detail. So firstly, there is a congenital anomalies of the uveal. In that, first is a heterochromia of the iris. It refers to a variation in the iris color and is a common congenital anomaly. So, the heterochromia of iris is a common congenital anomaly and it refers to a variation in the iris color. There is a variations in the iris color, so it called as the heterochromia of iris. In the heterochromia iridium, color of one iris differ from the other. So there is one iris color is differ from the other. And sometimes the one sector of iris it may differ from the remainder of the iris. Such a condition called as the heterochromia iris. So in that sometimes one sector of the iris is may differ from the remainder of iris, and such a condition is called as the heterochromia iris. The congenital heterochromia must be differentiated from the acquired heterochromia seen in heterochromic cyclitis, siderosis, and the malignant melanoma of the So when congenital heterochromia must be differentiated from the acquired heterochromia and it is seen in the heterochromic cyclitis, siderosis and malignant melanoma of the eyes. Then correctopia. So this is also a congenital anomaly. It refers to abnormally eccentric placed pupil. And normally pupil is placed slightly nasal to center. So normally in the anatomy when we study the pupil, so pupil is a placed slightly nasal to the center. That is, it is normal condition of the pupil. And when it refers to the abnormally eccentric placed pupil, then it is called as the correctopia. Third one is the polychondria. In this condition, there are more than one pupil. When more than one pupil congenitally, then this condition is described as a polychoria. Fourth is a congenital aniridia, that is iridremia. Iridremia. So, congenital aniridia is referred to the congenital absence of the iris. So, there is a congenital absence of the iris, and the true aniridia that is, the complete absence of the iris is extremely rare. So, there may be true and false aniridia. In the true, there is a complete absence of iris, but these cases are extremely rare. And usually, a peripheral rim of the iris is present, and this condition called as a clinical aniridia. So, usually, a peripheral rim of the iris is present, and this condition is called as a clinical aniridia. The zonules of the lens and the ciliary processes are often visible, and the condition is usually familiar and may be associated with the glaucoma due to the angle anomalies. So, zonules of the lens and ciliary process are often visible in such cases, with the condition usually familiar and may be associated with the glaucoma due to the angle anomalies. Next one is a persistent pupillary membrane. So, it represents the remnant of the vascular sheath of the lens, and it is characterized by a stellate shaped shades of the pigmented tissue coming from anterior surface of the iris and attached at the colon. And these are float freely in the anterior chamber or may be attached to the anterior surface of the lens. So, this is a diagrammatic representation of persistent pupillary membrane. In that, it represents the remnant of vascular sheath of the lens and characterized by the stellate-shaped shred of the pigmented tissue coming from anterior surface of the iris, and it is attached at the core. So these flow freely in the anterior chamber and may be attached to the anterior surface of the lens. So in this diagram, we can see the how the it attached to the anterior surface of the lens. Okay, this is a persistent pupillary membrane. Next one is a congenital coloboma of the uveal. So, the congenital coloboma, that is the absence of the tissue of iris, ciliary body, and choroid may be seen in association or independently, and coloboma may be typical or atypical. So, this is a typical coloboma of the iris, and this is a typical coloboma of the colon. So, shows that there is a congenital absence of the tissue of iris, ciliary body, and choroid, and it's associated independently. Coloboma is typical and or atypical. So this is the diagrammatic presentation. In that we can see how there is an absence of the tissue in the coloboma of the iris, and there is absence of the tissue in the coloboma of the colon. So, the typical coloboma is seen in the inferonasal quadrant and occur due to the defective closure of the embryonic fissure. So, when we see the typical coloboma, then in the inferonasal quadrant and occurs due to the defective closure of the embryonic fissure. And atypical coloboma is occasionally found in other positions. So this is a typical coloboma and this one is a atypical coloboma. Then there is a complete coloboma is also present. It extend from the pupil to the optic nerve, with a sector-shaped gap occupying about one-eighth of the circumference of the retina, choroid, and ciliary body, iris, and causing a corresponding indentation of the lens where the zonular fibers are missing. So, when we study a coloboma, that is the congenital absence of the tissue, it coloboma might completely extend from pupil to the optic nerve. That it extends from pupil to the optic nerve with the sector shaped gap occupying about the one-eighth of circumference of the retina and choroid ciliary body iris and causing corresponding indentation of the lens where the zonular fibers are missing. So there is a missing of the zonular fiber and it extends from pupil to the optic nerve and make a one-eighth circumference of retina, choroid, ciliary body. And so this is all about the congenital coloboma. So these are the congenital anomalies of the uveal tract. That is heterochromia of the iris, it is very common. Then correctopia, that is eccentric placed pupil. Polychoria, that this is a condition when there are more than one pupil. Then congenital anesthesia, that is erythremia, and in that there is a congenital absence of the iris. In the polychoria, there is a more than one pupil. And the next one is a persistent pupillary membrane. That is one. Then congenital coloboma of the uveal tract, that is the absence of the tissue congenitally, that we see in this diagram how there is a typical coloboma of the iris and coloboma of the choroid. Okay. Then the uveitis. So the uveitis, the term uveitis strictly means the inflammation of the uveal tissue only. And however, practically there is always some associated inflammation of the adjacent structure such as retina, vitreous, sclera, and the cornea. So, due to the close relationship of the anatomical distinct part of the uveal tract, the inflammatory process usually tends to involve the uvea as a whole. So, when there is an inflammation of the uveal tissue, then it is called as the uveitis. And however, practically, there is always some associated inflammation of the adjacent structures, such as retina, vitreous, sclera, and the cornea. So, due to the close relationship of anatomical distinct part of uveal tract, inflammatory process usually tend to involve the uvea as a whole. In classification, in that we can see anatomical classification of the uveitis shows that first is the anterior uveitis. That is, it is the inflammation of the uveal tissue from iris up to the pars plicata of the ciliary body. So we was learn in the anatomy of the ciliary body that there is a two part of the ciliary body. This pars anterior, which is a pars plicata, and the anterior uveitis means inflammation of uveal tissue from iris up to the pars plicata of the ciliary body. And it may be subdivided into the iritis, in which there is an inflammation predominantly affect the iris, and iridocyclitis, in which iris and pars plicata, that is the part of the ciliary body, are equally involved, and cyclitis, in which the pars plicata part of the ciliary body is predominantly. So, when It is subdivided into the iritis, iridocyclitis, and cyclitis. These are three types that in which the anterior uveitis is divided. In that, firstly, the iritis which mainly predominantly shows the affection of only eye, and when there is iridocyclitis, in which the iris and the pars plata, that is the anterior part of the ciliary body, is equally involved. And when there is a cyclitis, then in which only the pars plata part of the ciliary body is predominantly infected. Next type is intermediate uveitis. First, we've seen that is anterior uveitis. Second is intermediate uveitis. Third is posterior uveitis, and fourth is pan uveitis. So we will learn about the second type, that is the intermediate uveitis. It includes the inflammation of the pars plana and peripheral part of the retina and underlying choroid, and it is also called as the pars plana. So when we study the anatomical part, we see the ciliary body is divided anterior part and the posterior part. Anterior part 2 mm, posterior part 4 mm. Anterior part is called as the pars plicata and posterior part is called as the pars plana. So when there is an intermediate uveitis, then it includes the inflammation of the pars plana, that is the posterior part, and the peripheral part of the retina. Retina, it is the situated posteriorly. So there is the peripheral part of the retina is also inflamed along with the pars plana and underlying the choroid. So it is called as the pars plana and posterior uveitis. So it refers to the inflammation of the choroid, that is the choroiditis, and always there is associated inflammation of the retina. Hence, the term is chorioretinitis is used. So when there is a posterior uveitis, we will learn it is referred to the inflammation of the choroid. So choroid is situated posteriorly, and there is the inflammation of the